When was your last visit to the dentist?
About 8 months ago.
1 month ago.
Last June.
My last dental visit was about 2 years ago.
My last dental visit was on November 2022.
Last dental visit was in August of 2020.
My last dental visit was last year, December.
Last dental visit was around February 2023.
My last dental visit was sometime around this year.
Last year.
Last month.
What was your last visit's dental treatment?
Removing of my orthodontic appliances.
Dental treatment was tooth filling.
So, dental treatment kay tooth extraction sa premolars.
Adjustment for my braces.
I did visit the dentist to have my teeth professionally cleaned.
What was your initial concern before undergoing the treatment?
My last concern is because I needed to visit the dental clinic because I was complaining about the appearance of my anterior teeth not being aesthetic, so I need to have veneers in my front teeth.
My concern was if I would arrive on time on the dental treatment.
The concern is that it was a long time for me since I went to the dentist, and supposedly I was supposed to go there every a month or so, and it's been like 5 months since I went there, so my dentist might be curious with me, but it was okay.
My concern during the last dental visit I had was about my excessive overjet and overcrowding.
The initial concern is I feel like my teeth needs to get clean.
Initial concern was that I have a tooth decay.
My initial concern was I had a root fragment.
I was concerned a little about my dental health.
My concern was prophylaxis cleaning of teeth, and also I had an impacted tooth that was really disturbing.
How was your experience during the treatment?
The experience was really amazing.
During the treatment, my experience was I felt calm and assured that my dentist could do her job. Experience was, overall, it was good.
So far, Paulo Dental Clinic gives best quality service, and I like that.
My experience during my treatment was not as good as it was because my expectations was not met.
During the treatment, I feel comfortable in a way that the dentist's hand is very light.
First, it felt kind of weird because I had braces for almost 6 years, but eventually I grew out of them.
I feel fine. It was also great because the dentist was very accommodating.
It was fine as usual. My dentist was very accommodating, and we have a good relationship, so I am comfortable with her.
During the treatment, my experience was I felt calm and assured that my dentist could do her job.
It was good.
How did the outcome of the treatment made you feel?
It made me feel good because I was satisfied with the treatment.
The outcome did not make me satisfied because my concerns after a year came back.
It felt very good because, as I said, it was a long time since I went there, and finally my brackets were adjusted and my concern was taken care of.
I felt completely satisfied of the outcome of the treatment.
Some of my treatment was going out fine and I was satisfied.
The outcome was perfect because the results that I expected is what I saw.
Before and after your treatment, how was your communication with your dentist?
We didn't actually had a communication before the treatment because it's my first time going to that dentist because I usually go to my dentist in the province.
It was good because my dentist is friendly, so he treats me like a friend when he comes to me.
I just have to take care of it and not to, don't bite forcefully or don't eat hard foods so that the integrity of the material would not break.
Before and after treatment, my communication with the dentist was, a casual talk
and then she asked me about my dental hygiene, and then after treatment was some reminder to take good care of your teeth, your brushing techniques, and other oral health care tips.
And the communication was amazing because the dentist kept on, actually before, his assistant was the one who was tasked to communicate with me, but afterwards he asked me to call him or text him whenever I had a problem or I had an issue with the treatment.
It is good because my dentist is the best.
It was a good communication because they remind me a day before regarding my scheduled treatment.
As what I have said, my dentist and I have very good relationship. So our communication is very good because she is actually my tita, and I've been going to her since I was 4 years old, 5 years old.
Since the after treatment result, I was not really satisfied. Even before the treatment, was not really that open, and I was very hesitant, somewhat anxious, and the dentist itself was actually not very open communicated to her patients.
My communication with my dentist is good in a way that he is my friend.
We had a good communication.
Based on your experience, do you think that a good patient-dentist relationship affects a dental treatment? How?
I think a good patient relationship affects the treatment because if the dentist and the patient has a good relationship together, the patient will be able to trust the dentist in making the treatment process for him or her.
Yes. I think in a way it can improve the treatment outcomes.
Yes. If you have a good relationship with your dentist, you are ganahan ka balik-balik sa dental clinic.
Yes, it really affects the relationship because if you have a good relationship with each other, you would have better communication and less problems in between the procedures.
Yes, I think it affects the dental treatment in a way that if you have a good patient-dentist relationship, they will have trust and they will be able to communicate effectively. Thus, the treatment plan will be effective.
Yes, it always does because patient education is very important so that the patient will be knowledgeable about what he or she will be doing, and then communication, relationship between the dentist and the patient should be good so that there will be a proper communication and there will be a proper motivation of the patient.
Based on my experience, a good relationship between a dentist and a patient is really important in your dental practice because this aids in the success of your dental practice. And you know, when you develop a genuine connection with your patient, it helps them follow what you have given them, some reminders, tips, and they will also cooperate to the treatment, which also helps not just you as a dentist but them as your patient. Yes, because when you feel comfortable with your dentist, you can openly voice out your opinions and concerns with the treatment.
Having a good patient-dentist relationship is a must because knowing that who your dentist is, you're really protected and you ask for consideration to your dentist.
Yes, a good patient-dentist relationship affects the treatment because it makes you confident to the treatment and it also makes you appreciate the dentist.
For me, a good patient-dentist relationship is very important, very crucial in the field of dentistry. This is because it really affects the patient's satisfaction.
Yes, a good patient-dentist relationship affects a dental treatment because having a good relationship with your dentist minimizes your anxiety and leads to a better treatment outcome. Yes, because it makes me more comfortable with the treatment.
A patient that has good manual dexterity and one who follow-ups on their patient.
Yes, of course. This part, you should be sensitive to your patients. You should know what the patient wants, and you should create a relationship with the patient. And in doing so, you can build a better professional courtesy to him or her, and overall have a good treatment outcome.
Yes, it affects dental treatment because if the patient is not trusting his or her dentist, then he will have or develop anxiety and fear.
It makes a successful treatment